Welcome to EazyMed. In today's video, we'll be covering the topic of stroke, including its types, causes, symptoms, and treatment. Let's get started. Stroke is a cerebrovascular disease. This means that it affects the blood vessels that feed the brain oxygen. If the brain does not receive enough oxygen, damage may start to occur. Stroke occurs when there is 1. Ischemia to a part of the brain, or 2. Hemorrhage into the brain that results in death of brain cells. If blood supply stops, neurologic metabolism is altered in 30 seconds, metabolism stops in 2 minutes, and cellular death occurs in 5 minutes. Very low arterial oxygen levels, partial pressure of arterial oxygen less than 50 mmHg, or increases in hydrogen ion concentration also increase cerebral blood flow. Now let's discuss the types of stroke. Basically, there are 3 types of stroke. 1. Hemorrhagic stroke. 2. Thrombotic stroke. 3. Embolic stroke. Hemorrhagic stroke. Intracerebral hemorrhage is bleeding within the brain caused by a rupture of a vessel. Hypertension is the most common cause of intracerebral hemorrhage. Hemorrhage in the pons is the most serious because basic life function, respiration are rapidly affected. Sudden onset of a severe headache that is different from a previous headache and typically the worst headache of one's life is a characteristic symptom of a ruptured aneurysm. Embolic stroke. Embolic stroke occurs when an embolus lodges in and occludes a cerebral artery, resulting in infarction and edema of the area supplied by the involved vessel. The patient with an embolic stroke commonly has severe clinical symptoms that occur suddenly. Embolic strokes can affect any age group. Rheumatic heart disease is one cause of embolic stroke in young to middle-aged adults. Thrombotic stroke. A thrombotic stroke occurs from injury to a blood vessel wall and formation of a blood clot. The lumen of the blood vessel becomes narrowed, and if it becomes occluded, infarction occurs. Thrombosis develops readily where atherosclerotic plaques have already narrowed blood vessels. This image shows a blood clot blocking a main brain blood vessel, interrupting normal blood flow. The blockage prevents oxygen and nutrients from reaching brain tissue, leading to cell damage. It represents an ischemic stroke where reduced blood supply causes injury to the affected part of the brain. Warning signs of stroke: B. Balance. E. Eye. F. Face drop. A. Arm, unilateral weakness. S. Slurred speech. T. Time to call 911. Thank you for watching this video on stroke. If you found it helpful, don't forget to like, share, and subscribe to EazyMed for more simplified medical content. See you in the next video. Would you like me to format